demystifying
Yeah.
cerebellum. I'm not going to demystify it completely because that will be our only talk. So I'll be very quick just to give an overview of cerebellum. And cerebellum is quite a common talk, so you can, it's not about, what I'll cover is what are the most important things. It's 10% of the volume of total brain, but half of all the neuron in central nervous system is in cerebellum. So it's an enigma because we don't fully as yet understand. Especially we see a lot of cerebellar stroke patient. They can have a large cerebellar damage, but their symptoms are not very obvious. Okay, so there are obviously once they go home they might have some more difficulty which we pick up, but initially as far as the movement part, sometimes you don't see much or very minimal. They receive input which is mainly sensory, but they receive obviously cortical input as well. And dominant symptom is ataxia with normal strength. If you think of a orchestra, it is more as it works like a conductor. So when you are doing it there, but basal ganglion on the other end, it's a cast director. So they have got a bit different role. Cerebellum is more hands-on in case of, and whereas basal ganglion is bit abstract. So it's also a feed-forward system. So even when I am walking, for example, cerebellum is receiving input, giving input straight away, so that we can function. So if there is something slippery, we most of the time don't fall because cerebellum is understanding that there is, and why that is the case we will see. So it's like a fast forward system. So again in this motor hierarchy, cerebellum doesn't directly talk to the motor neuron unit. It talks to the higher level. It talks to cortex, it talks to the brainstem and the central pattern generator, which are part of the reticular formation. So we all know where is the cerebellum. It sits in the back of the brain. Now one of the things which you will see, because cerebellum is sitting in the back of the brain, if there is edema or damage or swelling, what is the danger?
Lamination.
So it can cause raised intracranial pressure very quickly. Okay, very quickly sometimes, especially if they are younger and things like that. What can you, if there is a large bleed here, and if the pressure is rising, obviously you can take the blood, evacuate the blood. If they have got an infarct which is causing edema, you can take the skull off, craniectomy, to allow the cerebellum to expand. Otherwise the patient can die very quickly. Cerebellum is part of the obviously hindbrain. It is connected with the brainstem with three peduncles: superior, middle, and inferior. And so if you look at the cerebellum, so they have got, so the basic structure is very simple. So they have got a cortex which has got three layers, like, then there is a deep nucleus and which sends the axons. So the output of cerebellum is always from this deep cerebellar nucleus. All the outputs happens from the deep cerebellar nucleus. Whereas the cortical nucleus, which there is a mnemonic MPG, molecular Parkingi and Golgi. So these are the nucleus which will modulate this deep and will give an output. Okay. So cerebellum, the main architecture, it has got a cortex, then there is a deeper nucleus, and then there is an output. The inlet and outlet of cerebellum is from three peduncles: superior, middle, and inferior. Any information from all the other parts of the body, they have to come through these three highways: superior, middle, and inferior. There is no other way. So all the information going out or coming in, that has to be from this. As we have learned before in the spinocerebellar pathway, where is the information for the ventral pathway is coming from and dorsal is coming from? Dorsal is coming from the inferior cerebellar peduncle. They don't cross. Whereas the ventral, they come through the superior, they go and then they cross through the superior again to the opposite side. Okay, so that is the only highway. That's how cerebellum communicates with the rest of the part of the brain. The important part of the cerebellar anatomy, I think physiological part is more important. So it has got this vermis, which is in the midline. Then there is paravermis. So these vermis and paravermis are very important for gait, stance, posture, our limb movement, reaching, grasping, and also for speech. Not just, it's for the language processing as well. It's not just articulation, it's for language processing. That's why if this is affected, sometimes patient can get dysphasia as well. The lateral hemisphere, on the other hand, so that's the lateral hemisphere. This is responsible for smooth pursuit movement of the eye. I'll go through that pathway, and learning new movement. If you want to learn a dance move, that's the part which is needed. Okay. And finally, flocculonodular lobe. This is the part which is for the vestibular system. So flocculonodular lobe acts as a vestibular nucleus, so it's entirely part of the vestibular system. Okay, and so that's one. Vermis coordinates midline movement, speech, gait, posture, and stance, whereas paravermis is more of the appendicular reaching, grasping, and other appendicular movement. Now, cerebellar hemisphere, the lateral part, what I've said is mainly related to movement. So eye movement and also learning new movement. So for example, if you are learning a dance move. But what we understand now, this cerebellar hemisphere is responsible for complex tasks like piano, dancing, singing. That's the motor aspect. But the posterior half is responsible for non-motor like language, affect, your mood, your thought, your executive, your social behavior. Okay, so see this, all this limbic system pathway, they will also go through cerebellum, like basal ganglion. Basal ganglion, we have got the motor loop, oculomotor loop, we have got the limbic loop, we have got the cognitive loop. Similarly, similar information goes through the cerebellum. So anything with action, be your mind and body, they have to go through these two loops. So that's the critical thing you need to know, like which is not being reinforced. And now we can understand that. And because it's just the beginning of understanding cerebellum. Cerebellum, as I said, is an enigma. It is only 10% of the weight, but the neuron is 50%. So there is lots of things they are doing we don't fully understand. And that's the part of the new understanding. So the deeper nucleus which are involved, for example, for the vestibulocerebellum is the fastigial nucleus. It goes out, the information goes out through the inferior peduncle. For spinocerebellum is the interposed nucleus, where it gives its output through the inferior peduncle. And cerebrocerebellum, it is through the dentate nucleus, which is the most important nucleus, and it goes through the superior and middle cerebellar peduncle. So their output is always, as I said, the output will always originate from the deep nucleus. There are three important deep nucleus. One is the dentes, one is the interposed, and another the fastigial. Fastigial is the vestibular system. Interposed is the spinocerebellum. So your movement or posture, balance posture and coordination of your trunk and the limbs, that's the part. But the cerebrocerebellum is the enigmatic part. What we, if you have to learn for complex motor action, complex thought, your that's where the dentate nucleus is involved, and they give their input to the superior and middle cerebellar peduncle. Blood supply of the cerebellum. Cerebellum is supplied by three arteries: posterior inferior cerebellar artery, anterior inferior cerebellar artery, and superior cerebellar artery. All of the posterior inferior is a branch of vertebral, and both anterior inferior and the superior cerebellar is branch of the basilar, out of which anterior inferior cerebellar artery, one of the characteristic is they supply, also they give a branch called labyrinthine artery which supplies the inner ear. Okay, so that's why if ICA is affected, patient most of the time will have deafness or very severe vertigo as well, because it supplies the inner ear. So cerebellum, cerebrocerebellum, dentate nucleus, they are more important for planning, but when it comes to execution, that is the spinocerebellum. Okay, so they will supply to the motor stem and the brainstem for executing, and vestibulocerebellum is to the vestibular nucleus, that is the entirely the vestibulospinal pathway. One more important thing, I think can't go on and on because otherwise we won't be able to finish. But one important thing, as I told in the beginning, cerebellum receives lots of information, proprioceptive information. That's the dorsal ventral spinocerebellar tract is giving all the information. It not only receives the efferent, so the brain is saying that you move to this motor unit needs to get stimulated to do the movement. So that information is called efferent copy. Okay, so that is cerebellum is receiving. When you are doing the movement, whether you are doing the movement properly or not, it is keeping an eye. So that's the reafference copy. So that's why it's a fast forward system. So it is not only having information what is the intended movement, whether you are able to carry out the movement properly or not, it is keeping an eye. So that is the key thing about cerebellum. So it's a fast forward system. It is able to know what exactly the movement is supposed to be, and whether you are able to do it correctly or not, whether you are able to reach the target. That's because of this copy they receive from the periphery, and that is the key. There are two types of fibers which goes to cerebellum. One is called mossy, another is the climbing fiber. Mossy fiber is the most common. That mainly bring the information about the periphery and also from the cortex. But one of this climbing fiber which goes through the olivary nucleus, that is responsible for learning the skill. So when you have to learn, this is the fiber which is responsible for making you learn this motor skill. So this is the microarchitecture. I'm not going, as you can see, this is the next slide is the one. This slide. So the output is always from the deep cerebellar nucleus. That will give output to wherever it is going, be it in the vestibular system, be it in the spino, be it in the motor cortex or in the premotor area or other part of the cortex or in the brainstem. But see, they are influenced by the fibers which are coming. So they are directly influenced, but they are mainly the output they receive from the cortex is through the Purkinje fiber. Purkinje is the inhibitory, and this deep cerebellar is the positive. So all this computation will give the final result. What is the output? So that's one of the important computational system, and that is actually replicated like basal ganglion in AI. Okay, so they use this sort of approach to reach to a conclusion. So it is a fit for forward modulation. It learned from mistake. All the fibers which is coming, the climbing fiber from the inferior alveolar, it will tell you whether this is right or not, and you learn the correct movement. Cerebellum is not needed if there is no chance of mistake. So if you are walking in a normal road without any surprise, cerebellum is not needed. But if it gets slippery, that's when without cerebellum you will not be able to adjust. So that's the feed forward. That is the most important concept. So non-motor function, I'll keep on telling, because language, cognition, affect, visceral function rely on the cerebellar circuit. That's the cerebrocerebellum circuit. Okay, that is very, very important. This is just the beginning. In next few years, you will see how many roles of cerebellum will evolve, because we are starting to understand. Cerebellum one of the important of the non-motor function is language, as I have said, and premotor loop with posterolateral dentate affect behavior, affect to appropriate situation. So you might not react in the appropriate situation with your, and vermis contribute to normal visceral function through hypothalamus and influence cardiorespiratory adjustment to postural change, exercise, and stimuli. So sometimes this patient can have autonomic dysfunction as well. I'll stop here. So that's, I think, more than what, I'm not going into detail of each of the territory, but you have got an overview of the cerebellum. So basal ganglion is more like a casting director, so it will choose which is the right program. It will say, yes, you start, you stop. Whereas cerebellum is a conductor. As the performance is going on, it is giving and as well as checking whether they are doing it and correcting it all the time until the thing is done. That brings our next topic.